It is that time of the year again. Temperatures are dropping and respiratory virus season is upon us. And today we have Dr. Pani Robinson, Medical Director of Virtual Care, and Dr. Abby here, the Chief Impact Officer at Sharp Steely, to talk about, of course, everything that has been going around, what could be going around. Dr. Abby, you and I were just talking about this. The summertime saw an increase in some of these illnesses as well, too, right?
Yeah, and this is actually something we've seen in the past few years. So it seems like COVID does have a summertime surge because of travel and all of that, and people just, gathering together. And even based on the county report, we do see that the number of people going into the ER for respiratory symptoms actually started to go up sometime around July, and it's still going up. So it's something that we need to be aware of.
Definitely, as we look forward here. Now, as we go towards the fall, we talk about respiratory illnesses, the common cold, flu, COVID, as we pointed out. You guys have a new service with the virtual urgent care. How does that work at Sharp Steely?
Yeah, it's a great question. So the SRS virtual care program really is from 7 a.m. to 8 p.m. every day of the week, and it allows for folks to be able to seek care for some of these respiratory conditions that are, not in a position to go into the office, or perhaps they're just don't want to get another infection by going to the office, right? Mm-hmm. And they can seek care that way and get their treatment rendered for them.
And is that maybe more so for a variety of different illnesses? Or are there some that maybe what you're feeling that this is not going to be a good idea for you?
That's a great question. So some of those stronger symptoms like chest pain or significant shortness of breath, or if you're really, really ill, we want to get you into the office so we can do a good examination and figure out what are the best approaches to take good care of you. Probably not a good idea for virtual care. But if you have other things going on like pink eye, you've got rashes, you've got, COVID exposure or other things and you're not sure what to do, that's a great way to do virtual care.
What has been the reaction from some patients?
They love it. They really, really loved it. And I have to say, Dr. Robinson has done such an amazing job of building this out. I have patients that will tell me that they did it during their lunch hour. It's very convenient for them. Even moms, for example, they can't leave their child to go in to the office. It's really, really been phenomenal. So we want to continue to provide this care for our patients.
We talk a lot of time about trying to find time to take care of yourself for your children. This is another option to be a little bit more convenient, right?
Absolutely, yes, because we actually do it even with pediatric patients. If you're a new patient to Sharp, we can do it as well. And so you can sign up. It's same day care. And it really, really is awesome and really, really great. A very, very convenient way to take care of yourself.
So we've been talking about summer, the virtual urgent care, but what are we seeing kind of going around here? As again, we love to celebrate the fact that it's going to be a little bit colder, but with that comes maybe some exposure to some things, right?
Yes, absolutely. So we have to remember that the data always lags behind what is happening in real time. But from the last report that we got from the county, we do see maybe about close to 900 cases of COVID, about 40 cases of flu was what was reported. But that's always going to be an undercount. People are testing at home. But we do have to remember that in general, as we go into fall season, people are going to be traveling. We have all the holidays that are going to be coming up. So we're going to continue to see people have to seek care for this. So it's important that we get prepared, we get our vaccines, and yeah, that's really what we need to do.
I was just going to say vaccines, now's the time to get the flu vaccine, right? Especially as we enter into the holiday season, peak flu season.
Absolutely, and I should say this, which is very important for everyone to know, the county also released a report saying that we had nearly 40,000 cases of flu last year. It was a really significant year. We had about 220 people that died from this compared to slightly over 60 people the year before, 7 children that died from it. So we know that vaccines prevent this. It's very important for us to get updated on our vaccines. Let's go ahead and get that done.
Okay. Doctors, thank you so much for joining us and letting us know so much more about what we can expect and some of the services that are available there at Sharp. Thank you, guys.